Clinical commissioning groups are new organisations, and we want to tell you more about how this will work in Gateshead. This presentation will talk about our challenges and vision, our relationships, our practices, our patients, and how we have progressed. We want to start with challenges and vision. I am Mark Dornan, a GP in Gateshead, and we want to start with why we are here. As a GP, I listen to people's stories of how they come into contact with services across the whole of Gateshead, and it gives me a great overview of what works well and what needs improvement. And as all of our practices listen to our public and patients, we're in a good place to see how things could be done better. As a clinical commissioning group, we now have the job of organising many of the services that patients use. This new health system is very complicated. It tries to put patients at the heart, and this diagram shows that there are many organisations involved in health. The inner circle after patients shows the providers of care, and the green circles outside of it show how organisations support and organise all that is provided. We are one of the pieces in this complicated jigsaw, and our job is to ensure that all of us work together to try and get patients the care that they need. Our story starts with geography. We have, and we need to have, good relations with our neighbours, and in particular our hospitals, and these are represented by our white dots. Let me tell you why. The Queen Elizabeth Hospital is not in the middle of Gateshead, and whilst most of its patients are from Gateshead, about a third of patient care is provided by Newcastle hospitals, shown by the two white dots here. For some of our patients it's much easier to get to them, and other patients use service from other neighbours. But to make matters more complicated, in recent years our services for the community teams have been provided by South Tyneside Hospital, and our commissioning of services has been done by our teams based broadly in Sunderland. We are keen to have a more local focus, and will work carefully with our colleagues in the Newcastle CCGs from a base shown by this white dot in Newburn. This will enable us to work with our colleagues in the commissioning support unit too. We're still keen though to focus on Gateshead, and our work with the local authority is key. All of this system is so dependent on our geography. Gateshead has had some of our most fragmented services, and so the first bit of our vision is to make this more seamless, that patients can get a service from the NHS no matter which person they choose to go and get their care from. History. Gateshead has a proud past and is known for its heavy industries and mining heritage. We are now better known for the Angel of the North, and it's a symbol of the amazing transformation of Gateshead, showing not just our care for the whole community, but the bright future ahead of us. It's built, though, on the site of a former mining disaster, and reminds us of the legacy of health problems our past has left us with. Our heavy industries have left us with poor health, and people have used a lot of hospital services, leaving us with little money to invest in new areas of quality. So the second part of our vision is to improve quality, but recognising we need to spend money differently and not so much on hospital care. Culture. From sport, such as the Great North Run, our parks and countryside, our music venues and arts, we have some of the jewels of the North East. We really are a metropolitan council around these assets. We have different communities though, such as former mining, and our Jewish community, our transforming town centre, and still many deprived parts of the borough. This presents us with local challenges leading to large differences in health. But our Gateshead culture is one of pride, pragmatism and stoicism, and we want to involve the different communities and clinicians so that health services are not just the best, but will be used and health improved because of that. So far we've talked about our challenges, those that have been left by our geography, history and culture, and our vision is to improve things by working together to improve the health of Gateshead. So firstly, we want to think about our geography that has left us with fragmented services, so that we can improve things by caring for people in a seamless way that isn't restricted by either organisational or professional boundaries. Our history has left us with high hospital use and little money to spare to focus on quality, so we want to improve the quality of health services and ensure that people of Gateshead live longer, healthier and happier lives. Our culture of varied communities with varied services that haven't always been used has also left us with challenges, and so We want to ensure that commissioning is clinically led and driven by patient and carer involvement. All of this can be remembered by these 3 words: care, for our seamless care, quality, and involving people. We are part of the NHS though, and although we have many of the NHS values written into our vision, the commitment of quality of care and the working together for patients, we want to particularly emphasise compassion with all interactions that people have, and we want to make sure that all people are improving the lives of our community whilst respecting and giving people the dignity and listening to their views so that everyone does count.